Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former health commissioner here in Baltimore. Our goal is to bring evidence and experience to illuminate critical public health issues. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Lindsay Smith Rogers, producer of Public Health on Call. Today, Stephanie Desmond talks to Ari Davis, a doctoral candidate at Johns Hopkins and a researcher at the Center for Gun Violence Solutions. They discuss new CDC data that suggests gun homicide and suicide rates spiked to their highest levels ever in 2021, and so did new gun purchases by first-time gun owners. Let's listen. Ari Davis, thanks so much for joining me.
Yeah, thanks so much for having me on today.
So today I wanted to talk about some new data that you and your colleagues have analyzed that comes from the CDC on gun violence. Give me the big picture.
Yeah, so we have looked at CDC gun death data from the CDC database, and it's based on death records. So during the pandemic, we were interested to see kind of what happened with firearm fatalities. And unfortunately, we've seen large spikes in gun deaths, both in homicides and an increase in gun suicides as well. And we did a large report looking at 2020 data, and we saw this really large increase. And just recently, the CDC made available provisional 2021 data. And we saw that the increase, unfortunately, continued into 2021. So we saw gun deaths increase, gun homicides increase by 45% from over the last 2 years during the pandemic. And we saw gun suicides increase by about 10% over those 2 years. But what's interesting is when you look at homicides that weren't committed by a firearm, you actually don't have there actually wasn't a large spike, right? So homicides by other methods only increased by 6%, and suicides by other methods actually decreased. So what we see is that this spike in homicides and gun violence was driven almost exclusively by firearms during the pandemic.
So why now? Why are we seeing these huge spikes?
Yeah, I think this is something that researchers are going to have to spend a long time untangling all the causal links to spikes in violence during the pandemic. But I think all the factors that disrupted our daily lives also contribute to the underlying risk factors for violence. So, for example, not having social supports within the community, being isolated, being worried about your job or losing your job, all these things can contribute to actually both gun suicide and gun homicide. And on top of that, during the pandemic, you had people who felt fearful, right? Who there's a lot of uncertainty at this time. And so they went out and purchased guns at record numbers, right? So we have record high gun sales. At the same time, we see this spike in violence. Now, there's not a researchers haven't established a causal link there, but we know that when, especially first-time gun buyers who might not know how to safely store a gun, when you purchase a gun and you bring that gun into your home, there's pretty solid public health data to show that increases the risk of suicide around 3 times. And it also increases the risk that someone in your home will die by homicide. It doubles that risk. So again, you have this it's really tragic, where people are wanting to purchase guns because they want to keep themselves and their families safe, and they believe that that's going to make them safe. But the reality is, for many, it could end in tragedy. That aspect of gun purchases probably, in some ways, contributed to the spike.
Mm-hmm. And it seems like we're just seeing. I was surprised by the numbers of people buying guns in the last 2 years. It was shocking to me. Is it shocking to you?
Yeah, I think given that there's so much uncertainty in this, you have this common perception that I think the gun lobby and folks have been really good at pushing that, like, having a gun is going to make you safer. And that's, really a myth based on the evidence. That's not the case. But I think that it's not surprising to me. Like, I had my dad, even, he said something like, oh, like, because there was other instability during this time as well, right? We had the insurrection on the Capitol. We had a lot of protests and uprisings around racial justice, and a lot of people just felt insecure. And so, unfortunately, folks turned to purchasing guns.
Now, we're very attached to our guns in this country, and now we have more of them. So removing the danger of guns is not going to be feasible. What can we do to reverse this?
Yeah, so I think the approach that we take at the Center for Gun Violence Solutions here at Johns Hopkins is really public health approach, right? We need to look at this. There's many different types of violence, right? So we need a number of different programmatic and policy solutions to address this. But the first would be to kind of start at looking at, what are effective policies? And our center has done a lot of great research on gun purchaser laws. So to purchase a firearm, you have to go get a license in certain states. They found that when you go in, when they have a law where you have to go in and apply before you purchase a gun, has strong reductions in suicides and gun homicides. So it's not restricting folks who can legally purchase a gun can still do it. They just have to go in and get fingerprinted and apply. And so that's one public health solution that can help reduce this crisis that we're seeing. But I think other ways, so extreme risk protection orders is a great way to, so what these laws do, and this is something that the center and Johns Hopkins has been helped lead and push. I think it's 19 states that now have these laws. But what they do is they empower family members and law enforcement and sometimes other stakeholders to petition a court to temporarily remove a gun when someone's in crisis, right? So we know that, sometimes folks who, go through hard times and crises. And so having that tool to temporarily remove the gun can save lives. And that's what we've seen through the research.
And the data shows some disparities. Can you talk about that?
Yeah. So during this spike, so folks from all walks of life are impacted by gun violence. But you have, when we're looking at especially gun homicides, Black and Hispanic Americans are disproportionately impacted. And that's because of a lot of the root causes of violence and structural factors. They can be traced back to redlining and racist policies. What we saw is disparities actually got worse in the last year. And actually the gap between Black Americans and white Americans was so Black Americans were almost 14 times more likely to die by gun homicide. And that was the largest disparity that we've seen in over a decade. And when we look at suicides, gun suicides actually typically impact or disproportionately impact folks living in rural areas, often white men, right, who tend to be gun owners. So we see that, around 80% of all gun suicides in 2021 were among that group, among white Americans. But we see the largest rises and increases in gun suicides among Black people. So while white people saw from 2020 to 2021 an 8% increase in gun suicides, Black people saw a 21% increase in gun suicides. So again, those relative increases are disturbing, and we need to address those disparities.
We know why.
It's going to be challenging to disentangle all these factors, but I think during the pandemic, we know that it exacerbated racial disparities in a number of different health outcomes, right? We saw that with COVID. We saw that with loss of jobs. So there was a lot of things that when COVID happened, it exacerbated disparities. And so I think that is likely a contributing factor.
And I saw, it was interesting that you said that suicides by other means are down. I guess to me, that just makes me think people who are suicidal, if they didn't have these guns, would they be taking action?
Reducing access to lethal means among folks who are suicidal is a primary or key strategy for reducing suicides. And so we know that when someone attempts suicide by firearm, the chances are, I think, over 90% of the time that it's fatal. But when folks use other methods such as cutting or taking medication, the lethality is much lower, right? So between 3 and 5%, right? So if we can limit access to lethal means by people who are in crisis, we can save lives. But yeah, what we've seen, what was kind of interesting during the pandemic, is everyone expected gun suicide rates to increase in 2020. And so when we did our first analysis, we saw that gun suicide rates actually didn't increase that much from 2019 to 2020 during the beginning of the pandemic. But now when we get this data from 2021, there was maybe a lag, but now we saw actually the largest 1-year increase in gun suicide rate ever from 2020 to 2021. So it was kind of flat from 2019 to 2020, and then it just increased really sizably in 2021.
So what do you take away from this?
Yes, it is disheartening. Again, going back to solutions, we know that these deaths are preventable. So that's something at the center that we are working, day in, day out, is to communicate the evidence on how to prevent these deaths. And we've had, great public health successes in a wide range of fields of areas in the field of public health. So we know that if we take a public health approach, we address, the risk factors for gun violence and the root causes, we can reduce this epidemic.
Ari Davis, thanks so much for joining me.
Yeah, thanks so much.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Holly Cardinell, Spencer Greer, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Holes Fernandez and Amber Bryan Singletary. Thank you for listening.